I'm in the Applied Medical Science class, and my teacher is Rebecca Martinson.
I'm in the Applied Medical Science program, and my teacher is Miss Martinson.
I'm from LaCarna School District. I'm in 11th grade, and I like to play soccer and hang with my pets and friends.
I'm from Cedar Woolley School District. I'm a senior, and I like to do sculpture and wrestling outside of school.
I am Rebecca Martinson, and I teach Applied Medical Science. This is my 12th year at NCTA. What do I do when I'm not here? I have 3 dogs, so mostly dog things. I also volunteer as a nurse out in the community. I've taken part in several vaccination clinics and just some community health projects.
It's like more specific than Running Start and my school, so it's like I can get the medical class. It's like different from SVC and my high school, like very different, and it was just a better option for my future if I came here.
My class is a deep dive into all aspects of medical science. Obviously, I'm a nurse, so my focus is on nursing, but the class is really appropriate to anyone with any interest in medicine. We're going to take a really close look at the human body and then how to care for patients. And I think even if you decide not to do medicine, this will help you take care of members of your family in the future that might need your help.
So originally when I was a sophomore, I had no foresight on if COVID would happen or not because that wasn't a worry back then. And so I tried going over to do the pre-nursing program over at Skagit Valley College for Running Start. However, I failed drastically due to the fact that it was a lot harder to do online schooling for college level classes. And so I was talking with my counselor and she said it would be a good idea to do the Applied Medical Science program here at NCTA. It offers a NAC degree at the end of the year, so that's what I was shooting for.
Yeah, my teacher is very helpful, and when she's teaching, she's actually teaching, but also getting to know us. So like I feel like I'm in a good place, like academically and mentally and like physically. And she just makes it so much more enjoyable.
Hi, Mrs. Smith. I'm Rebecca. I'm going to be your nursing assistant today. And today I'm going to help you with some range of motion activities. All right, so I'm going to go 3 times. If you have any pain, let me know and I'll stop. Okay. 1, you relax, 2, 3.
She brings a lot of life to the class. I've had many teachers where it feels like you just go there and you're drained by the end of the class because it just feels like they're spitting information at you. Well, Miss Martinson makes it feel like you're actually learning something and you feel almost safe in that class, like you're just there to learn.
I think that every student comes here with a different goal in mind. So we're trying to get everybody to a common endpoint. We want to get everybody certified so they can go get a high wage earning job. We want everybody to earn their college credits. But my job as a teacher is to find out what knowledge, what instincts, and what prior experience you're bringing into class so we can build from that.
This class is more hands-on than anything else. I like that the other students, it feels like we all choose to be here rather than like high school, you have to be there, but here it feels more like you want to be here and you want to learn and be able to go and shoot for our goals.
It's a long session and I think that intimidates people, but every day we get to try something new. Sometimes I have guests come out from industry, but also we go and do clinicals at a local long-term care facility where we do hands-on treatment of real patients. My classroom probably looks different than any other classroom you'll ever go in because I have a 4-bed hospital suite set up at one side of the room where I'm going to teach you every aspect of introductory patient care. So a typical day will usually be me giving some kind of new information through lecture, and we'll do some type of activity together, and then we'll get into the lab and actually practice what we've learned.
We get time to work on our work. We get time for our lecture and labs. We actually get to learn, which is why I like it. I'm going to go to a 4-year college, university, and then work as a nurse, preferably a behavioral hospital.
From here, I'm going to continue to go to Skagit Valley College, and I'm going to be doing the nursing program because after a year here, I'll be done with the applied medical, which would have my NAC degree.
When you graduate my class, you'll take your test to become a certified nursing assistant in Washington State. This is a high demand field. Many students use that experience as an NAC, a nursing assistant, to go on to nursing school, become a medical assistant. I have doctors who are former students. If you can imagine a career for yourself in medicine, you can start here and get there.